You'd be shocked to see how many people come to me after a botched injection. Not everyone who sticks a needle in you should be doing it. Bad injections are way too common. Wrong spot, wrong technique, wasted money, and sometimes they cause more harm than good. My name is Dr. Sonam, and I'm an interventional sport medicine doctor. And today I'm going to show you how to pick a safe sports medicine injector, the signs that you can trust them, and the red flags that should tell you to run away from them. So let's start with what a good injector looks like. Number one, they have proper training in interventional sport medicine treatments. So this can include a variety of different types of physicians. We have sport medicine physicians that are fellowship trained, interventional physiatrists, interventional radiologists, and many orthopedic surgeons. Now, surgeons tend to really focus on the operative aspect of things, but there are a number of orthopedic surgeons who will still do non-surgical interventional treatments in patients. Just make sure you know the credentials of who you are seeing. Number two, they use imaging, either ultrasound or fluoroscopy, to guide the needle and not just do blind landmark guided injections. There was a time and place for blind injections. However, technology has come such a long way that the standard of care is to now image guide our injections. In my practice, I use ultrasound to guide injections. Fluoroscopy is continuous X-ray technology. It's got a lot more radiation associated with it, and it's usually reserved for really difficult injections done at the hospital or injections into the spine. Number three, they explain your diagnosis, and they don't just say, let's inject and see what happens. When I see a patient, I do a proper assessment and I tell them what I think is going on prior to doing their injection. Make sure that you get this information from your injector. Number four, they go over risks, benefits, alternatives before anything touches your joint. Before I inject any of my patients, I give them the list of all of their options, including doing nothing and waiting. Make sure that your injector discusses with you these options so you can give them informed consent before your injection. Number five, make sure that they speak with you about your rehabilitation plan, because injections alone are not magic. When I perform an injection, I never just do the injection and send the patient home. I talk to them about integrating therapy and rehabilitation to get the most benefit out of their injection. Now let's talk about the red flags of what to look for. These are going to be your deal breakers. Number one, they do not use image guidance to do their injections. Like I said before, there was definitely a time and place for blind injections, and I will still do them in my practice if I have a very old patient who can't lie down, who's got knee arthritis. But the vast majority, and now the current standard of care, is to use image guidance for almost all of your injections. Number two, they push expensive treatments with miracle claims. Now, everything in medicine comes with risks, and nothing is for sure. So if they're telling you that it will regrow cartilage, or it sounds too good to be true, question it before you proceed with it. Number three, their credentials are vague, and you're not sure whether or not they trained in ultrasound-guided injections, interventional pain management, or sports medicine. Make sure you ask what level of training they've had. If you're not sure about it, I would wait and find another injector. Number four, there's no follow-up after the injection. They inject and bill you. When I see my patients, I always have a follow-up plan for them, whether it's come back in 3 months if this is not working, or come back in 2 months. If this is not working, we can try another injection. Make sure you have a follow-up plan. If they do not give you one, be wary. Number five, they dodge your questions about side effects, failure rates, and alternatives. I always talk to my patients about these, and it is important that you have this information to give true informed consent. So make sure you ask your injector about this, and if they can't answer it, be wary about proceeding with an injection. Now that I've talked to you about things to look for and red flags to avoid, I'm going to give you 5 simple questions that you can ask to help make the decision on whether or not this injector is good for you. Number one, will this injection use image guidance? Number two, can you tell me my diagnosis and how this injection will help me? Number three, what are the benefits and risks of the injection I'm going to receive? Number four, what should I do after my injection, and what are my post-injection instructions? Number five, what happens if the injection does not work? Safe injections can change lives, and bad ones can cause more harm than good. So it's okay to be picky, because your joints deserve it. If you'd like to support my channel and get access to exclusive resources I create for patients and the educational community, you can join my Patreon below. It allows me to keep creating free evidence-based videos for the YouTube community. If you found this video helpful, share it with someone else considering an injection. You may save them pain and thousands of dollars. And don't forget to subscribe for more insider sport medicine-based content right from my clinic. For now, that's all.